All right, welcome back to ABA exam review and the continuation of our RBT practice exam series, where we're going through another set of questions together and breaking them down. If you're new to the channel, welcome. If you're turning, welcome back. Please like and subscribe. Check out btexamreview.com for all of our study materials, including our combo pack. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A dance instructor always starts the first class of her summer session by observing and measuring what her new students can and cannot do. The instructor records this data without delivering any instruction prior to measurement. What type of data is the instructor likely taking? So, on your exam, you might have questions that are more applied, meaning they might not necessarily involve a technician or a clinical setting. And that's okay because ABA is all about human behavior. So, when you get a question like that, you want to put yourself in the position of the person in the question. In this case, we're looking at the instructor who is taking data. We know the instructor is starting the first class of the session by observing and measuring what students can and cannot do. So if we immediately start there, this instructor is trying to get an idea of where her students are at currently. So she's recording the data without delivering any instruction prior to measurement. What kind of data are we collecting if we're trying to just get an idea of where our client is currently at? If I haven't provided any teaching, any instruction, and I'm still taking data, what kind of data am I looking for? A, baseline. Yes, baseline data comes prior to any instruction, any intervention. Baseline data is going to show us once we introduce intervention if we're making an impact. Without baseline data, we have nothing to compare intervention to. So, baseline data is very, very important, and that data is collected prior to instruction. B, intervention, because we always read all of our answer choices. It is an intervention data, right? Because this is data prior to instruction. C, maintenance. Maintenance comes after intervention, and we haven't even started intervention, so it can't possibly be maintenance. And then D, none of the above. Well, we already decided that this was baseline data. Baseline data is data recorded prior to any instruction or intervention. We're trying to get an idea of where the client is at. A behavior technician has been asked by the supervising analyst to help train a parent to effectively use reinforcement strategies at home. During prior sessions, the technician has demonstrated competency and understanding of the reinforcement strategies to the point where the analyst trusts them to train the parent on these strategies. What is the behavior technician's appropriate role when providing this training? When you see a long question, don't panic, don't zone out, don't get anxiety. Don't worry about the length of the question because even the questions that are long could be quite easy if we approach them the right way. This one is just asking, what is the technician's role in giving this training? We know the technician was asked by the analyst to train a parent on strategies, and the technician is competent and understanding, and the analyst trusts them. So all is well. The analyst was asked the technician to do it. The technician is capable of doing it. So the question only needs to know is what is going to be the role of the technician when actually providing that training. A, create a new behavior plan as the parent discusses any issues they may be having. Now, A is trying to give the technician too much responsibility. All the technician has been asked to do, and all they're competent in doing, is providing the parent training on reinforcement. They're not there to create a brand new behavior plan. B, answer every parent question regardless of the scope or subject. If the parent starts asking about punishment strategies or asking about schooling or these other things outside of the technician's scope, that is when the technician should start referring to the analyst. Just because the analyst told them to train on reinforcement doesn't mean they can go in and provide training on everything else. C, demonstrate the reinforcement strategies as directed by the supervisor. Yes, that's all we want, right? Whatever the technician was asked to do and given permission to do and is competent at, which is reinforcement strategies, that's where the training should stop. D, provide additional recommendations on how to incorporate the extinction procedure at home. Now we're going even further, right? The training is on reinforcement. It needs to stay within the scope of reinforcement. No more, no less. So, what is the technician's role? C, demonstrate the reinforcement strategies as directed by the supervisor. Which of the following scenarios does not accurately represent frequency recording? The hardest part about this question is the not, because frequency recording should be very straightforward. Frequency recording is just a count. We're counting how many times something happens. The question is saying which scenario does not accurately represent frequency recording, meaning if we have four choices, three of them should represent frequency and one won't. So let's try to identify these scenarios that do represent frequency. A, tracking the number of times a client initiates conversations with peers during free play each day. When dealing with measurement questions, you want to look for some key ideas. If we're talking about number of times or amount or count, it's typically going to involve frequency or rate. If we're talking about how long something is happening or time, then we're looking more along the lines of duration and latency and into response time. So if here we're looking at the number of times conversations were initiated and we're counting that, that is going to be frequency. B, counting how many math problems a student correctly solves within a 15-minute time test. We're not worried about the time test here. We're worried about how many math problems were solved. So B is very clearly frequency. C, recording how often a client engages in hand flapping during a therapy session. Again, how often are we engaging in hand flapping? We need to count how often hand flapping occurs. So C is very close to frequency recording. So that leaves us with D, measuring how long it takes a client to begin homework after being prompted. Well, now we have this phrase, how long, which indicates time. We're timing the length of time it takes a client to begin homework after being prompted. D looks more along the lines of something like latency. So which of the following scenarios does not accurately represent frequency recording? D, measuring how long it takes a client to begin homework after being prompted. A behavior technician presents a discrete trial. Tell me your name. The client correctly says their name and the technician provides praise followed by a brief pause. The technician does this 3 more times before moving on. How soon after the response should the technician be delivering the consequence? I like this question because it gives you a lot of information, and then the question kind of throws a curveball at you because it doesn't really pertain to what we just read, other than we know it's a discrete trial session, right? The question wants to know how long after the response should the consequence be delivered? And this goes for all consequences. We want our consequence to be delivered as close to the response as possible. The further away that consequence gets from the target response, the more likely it is that consequence is going to influence something else. So if we have a technician doing discrete trials of tell me your name, and they're providing praise, we want that praise to come as close to the name being said as possible. So A, immediately after the response, is what we're looking for. The technical term is contiguity, the closeness of that consequence. And we want that consequence as close to the target behavior as possible. B, 1 to 2 seconds after the response. C, 3 to 5 seconds after the response. These times aren't relevant, right? We want it immediately after the response. The shorter, the better. And then as dictated by a schedule. You're not going to have a consequence schedule. Again, if my response occurs and I wait 15 seconds to praise, the chances are I'm praising something completely different than my target response. So we want that consequence immediately after the response. A behavior technician is asked by their supervising analyst to determine whether a client can independently perform a skill without prompts or reinforcement. The technician gives the instruction and observes the client's response without providing prompts or reinforcement, then records the outcome. What assessment strategy is the technician using to check if the client has mastered the skill independently? So we're talking strategies here. And what are we trying to determine? We're trying to see if the client has mastered this skill. What is the technician doing? They are trying to see if the skill can be performed without prompts or reinforcement. So an instruction is given, observation occurs, no feedback is given, no further instruction. What are we trying to do here? Well, we're just saying, can this client do it or not? And so when we're just trying to see if someone can do something or can't, what is that called? A functional analysis. A functional analysis involves determining the function of a behavior through manipulation of the environment. It's not what we're doing here. We're not manipulating the environment. We're just asking the client to do something. So what we're doing here is probing. We're probing this client. Can they or can they not? C, indirect assessment. An indirect assessment involves not observing the behavior of interest, right? Interviews and surveys, not actually watching the behavior happen. Here, we are directly assessing that behavior. And then D, incidental teaching, also known as naturalistic teaching. Well, we're not teaching here. We're just trying to figure out, can the skill be done? We are probing to see if the skill can occur. Please check out btexamreview.com for all of our study materials. Thank you for watching. Subscribe if you aren't already. When you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard,